Hi, my name is Himali Hinkinde and I am a lecturer at International Institute of Health Sciences. Today, we are going to talk about the empowerment in nursing. So, beginning, we'll see what are the learning outcomes that we are going to achieve. First, describe the empowerment from the different theories. Example, critical social theory, organizational and management theories, and social psychological theories. Second one is state the need for empowerment in nursing. Third one, state the qualities of an empowered nurse. Fourth one, state the factors that promote or prevent empowerment. Next, explain the empowerment in nursing. Explain the impact of empowerment in nursing and describe the relationship between empowerment and the professionalization in nursing. So, as introduction, we'll see why the nurses need power. There are compelling reasons to empower nurses. Powerless nurses are ineffective nurses. Powerless nurses are less satisfied. They are not much satisfied with their professional works, with their activities that they are going to perform. And they are more susceptible to burnout and the depersonalization. We'll see the definition. What is empowerment? It is to invest legally or formally with power or authority. Empowerment suggests that an individual is vested with formal or legal power or authority to perform certain tasks. As a nurses, they has to have a power to go ahead with the activities that they need to perform. Likewise. And we'll see the characteristics of the empowerment. Empowerment is an abstract concept that is positive. It gives the good value. And the dynamic concept, power can be given, taken, and also power can be shared. In the empowerment process, individuals, organizations, and the communities perceive maximum impact on their lives and the eventual choices. Next, it is associated with growth and the development. In the empowerment process, individuals need to critically examine their own strength, thoughts, feelings, reason for action, and change their patterns of activity accordingly. Next, in the community, empowerment is referred to people uniting to achieve a common goal. So why we need power? Nurses' power over their practice is influenced by social, cultural and the educational factors. Normally, everybody thinks that nursing is a woman's work and women are not much socialized. Traditionally, nursing education based on the hospitals and the multiple entry levels for the profession. There are many entry levels like diploma, bachelor's, likewise. And there are many influence towards the nursing. And we are going to study about the empowerment theories. First one is critical social theory. Second one is organization and management theories. Third one is social psychological theories. And we'll see what each theory says about the empowerment. When it comes to the critical social theory, it says this theory assumes that certain group of people in society are in a subordinated position. The controlling group has greater power and status than the subordinated group. Superiors always have the power to control the subordinates, simply. An increase in power or one party is compensated by another party surrendering his or her power, can influence. Then powerful people are not going to hand over their power unless they are assured of the benefits of doing so. Sometimes they will think that they are going to put their activities or their performances in danger by giving the activities to others. And this theory gives on negative feeling of empowerment. So we'll see what are the negative feelings or negative connotations of critical social theory. Relationships among nurses are often hierarchical and competitive. It is very bureaucratic, like hierarchy we have in the nursing profession. And nurses would use manipulations to obtain what they desire. Sometimes in a good manner or the bad manner, somehow they are going to achieve what they want. And they would bully each other. Horizontal violence is found within the nursing culture. And there would be no support for each other during conflict. Everybody needs to safeguard by themselves. Then there would be disrespects towards nursing student. And next is the organization and management theories. Empowerment is concerned with the distribution of power in organizations, particularly when it occurs in a top-down manner. So, in this theory, there is no oppressed group. Structural factor within the organization is important than the individual qualities for empowerment. And this main perspective of this theory says opportunity for advancement, access for information, access to support, and access to resource. So, the main responsible body is the head of the department or the different organizational subunits are responsible to provide this support. Continuing these organizational theories, here power is seen as the ability to get the things done. Basic element of the opportunity to take actions which brings positive effect to organization and the individual. So, positive aspects of empowerment for the organization are trust in working setting, reduce job strain and the burnout. Next, the positive effects of leader behavior on staff nurse empowerment. The most common feature of empowerment is the transformation of leadership to ensure more effective operations in the organization. When it comes to social psychological theory, empowerment considered as process of personal growth and development, which is influenced by the individual beliefs, values, views, and the perceptions, also the relationship with the environment surrounding. Issues are environment, race, sex, leisure, interest, role, and social standing. Empowered person does not pretend to have acquired more power but feels empowered. Why? It is a positive self-identity. Each and every people have the uniqueness of the identity. They know what this individual is worth, what these performances, how their performance, and how their performances level, what are the competencies level. And the ability to extensively reflect on their environment. They know what's surrounding. And the ability to interact in the social environment appropriately. And empowerment for them means independence, responsibilities, and autonomy in decision making. It is very important. It all rely on the individual, how they work. And the empowered nurses have more self-confidence and the freedom to give care. The need for empowerment for the nurses. Nurses need to be empowered to make optimum contributions to nursing care. There are 3 types of power needed. First one is they need the control over the content of practice. Next one is control over the context of practice. And the third one is control over the competence. We'll see what are those says. When it comes to the control over the content of practice, what they need to gain autonomy. It is a kind of decision making power. And raise nurses' own status, individual status, and define nurses' areas of expertise. What are the specialty? What are the areas that they need to be specialized, expertise? And the achieve and maintain nurses' influence. When it comes to the control over context of practice, what they need to be more involved in the running of the hospitals through empowering organizational social structure. Nurses can support that. Then decentralized and participatory decision making. It is not within one leader or within one manager. And strengthen the effects of empowerment on nursing practice behaviors. It basically concerns the skills and the area they work. When it comes to the control over the competence of nursing practice, what they need, a prerequisite for both autonomy and power. If they are not competent enough, they can't achieve the decision-making autonomy and the legal power. And the educational preparation is the foundation for the competence of nursing. Knowledge development enhances the maintains power. And nursing expertise generate power and it is going to affect to the direct patient's care outcome. Then we'll see what are the qualities of an empowered nurse. There are many qualities, good moral principles, and the personal integrity, and their expertise in their practice. They are future oriented, and also the empowered nurse's sociability is high. We'll see each and every one. Then moral principles. What the moral principles says? If they are in a kind of good moral principles, they treat with respect. They can identify what the others think, what the others need, what their position is, and act honestly and act justly. Personal integrity, how they are going to maintain? Look after own well-being. They need to maintain their good health and dare to say and act, both assertive and they are courageous and able to act under pressure. Also, they are broad-minded and the flexible according to the other need. And when it comes to the expertise on the nursing, basically they act very skillfully and competently. Then personal power to make decision. Individual, they use their personal power and act independently and autonomously. Responsible enough to consult and teach colleagues. That is how they become expertise. And they are future oriented, innovative and creative in finding solutions. They practice this problem solving very well with innovative ideas, newly created ideas. Then promote new idea enthusiastically at the workplace. Next, the forward thinking. Plan ahead and assess effects before acting. Sociability. When the nurses are high in their sociability, they are open-minded and discuss openly and respected by others as they work for common goals. The individual identify as the nursing profession is going to increase when they are moving with the society and socially responsible in solving problems. Next, we'll see what promotes the empowerment. It is a common nursing philosophy and general agreement on the outline of nursing. Second one, respect for others in the unit. First, before gaining the respect from others, everybody need to understand the respect towards the others. Next one is the leadership that gives opportunities for participation. They have to have a proper leader, which they need to consider other requirement, others' requirement, and they are kind of allowed to give the opportunities for participation with the other activities. Delegation of responsibilities by senior staff and placing confidence in subordinates regarding outcome. It is kind of giving responsibility, distributing responsibilities for different other people and monitoring it. Provision of information, optional training. Next, the reciprocal assistance and teamwork to promote the subordinates' confidence. Once we have delegated, you have to promote. We have to see how they are working. Next, continuous professional development to grow expertise. It is kind of how you are going to increase your knowledge and how you are going to increase your skill level. Then positive work culture. When problems are discussed and solved in an atmosphere that allow freedom to experiment and stimulates and support everyone's ideas. We have to respect for everybody's ideas, and what we need to do, we have to support for them to come up with newest ideas. But there are some hindrances for empowerment. We'll see what are those. First one is conflicting values, which among nurses it is going to prevent the empowerment. And bureaucratic and hierarchical organization and the work unit. So they are not going to give the power if they are bureaucratic and hierarchical. The top point hold in all the responsibilities and the power. Next, an authoritarian leader denies participation and shared responsibility. This type of leaders will not accept others' opinions and they are not allowed to participate. Then resistant to change in any development work. They are not kind of actually accepting new changes. Then scarcity of resources which reduce the activities. Conflict and lack of openness. And next one is the barriers and lack of cooperation among professional group, among nurses and the other team members. So we'll see what are the effects that we have experiencing due to lack of empowerment. It is going to have effects on the nurse and the organization. Next, effects on the patient outcome ultimately. And effects on the student nurses also. So we'll see why we need this empowerment. It is very important area to improve to achieve the professionalization. Without empowerment, it is hard to achieve professionalization. So empowerment is also closely linked to autonomy. If nurses are not empowered, they have no control over content, context or competency in their practice. So if we are not able to achieve the control of those three areas, it is very difficult to achieve the professionalization. So as nurses, everybody need to know what is empowerment and how we can improve the empowerment and how it is going to achieve the professionalization in nursing profession. Thank you.